Welcome. Today we are going to talk about anxiety disorders. Anxiety disorders are among the commonest mental disorders, and many people experience physical symptoms related to anxiety, and these are the symptoms that subsequently take them to the primary health care provider. These disorders share a feature of excessive fear and anxiety-related behavioral problems. These disorders include 1. Separation anxiety. This is a type of anxiety that happens especially in children when they are moving from a figure that they were used to another figure. It tends to affect them, especially if it's a child who the parents don't stay together and is moving between parents. That affects them. The other one is specific phobias. An individual has intense fear that cannot be explained for a specific situation. Some may have excessive fear of things like blood or needle pricks. The other one is social anxiety disorder. These individuals have extreme fear of being in a social situation, coming and speaking in front of people, or any situation that requires them to actually interact socially. The other one is panic disorder. These individuals present with panic attacks, multiple panic attacks. A panic attack is experienced in a way that this individual, out of the blue, they have a feeling of impending doom. They are aware of their heart beating, their heart is beating faster. They are breathless. They are pacing around and they think something bad is going to happen. The other anxiety disorder is agoraphobia. This happens when an individual has excessive fear of being in a place where they cannot run away from. Places like trains, places like in a train, in a plane, or in a lift and elevator. They're afraid they can't easily exit. The other one is generalized anxiety disorder, where these individuals have extreme fear of things they can't basically put a finger around and they're irritable. The other disorder is obsessive-compulsive disorder. These individuals have a repetitive intrusive thought that I got dystonic. They don't like them. And to relieve these thoughts, they are compelled into certain activities. For example, someone who is obsessed with cleanliness. Because they feel all the time their hands are dirty, they are compelled to hand wash severally. A person who is obsessed with security is afraid something is going to happen. They are compelled to go and switch on the lights all the time, switch on and switch off, to relieve this anxiety. What are the causes of anxiety disorder? It also follows a biopsychosocial model. Genetics play a part in that it's passed on through the DNA. And this also interacts with situations like stress or traumatic event that together produce the clinically significant syndromes of anxiety. How do you investigate these anxiety disorders? Basically, there's no test to make a diagnosis, but the investigations are done to rule out medical causes. Investigations like a complete blood count, thyroid function test, urinalysis, urine drug screening, electroencephalogram, and electrocardiogram, ECG or EEG. How do you manage them? It does follow a biopsychosocial model as well. Psychotherapy is one of the mainstays, or talk therapy. One of the things is the cognitive behavior therapy, where we address the wrong thoughts or the wrong cognitions. And like I said, it takes about 11 sessions, one per week. The other one is what we call systemic desensitization. For example, if someone is afraid of flying, so what happens is you systematically expose them to this situation they're afraid of. For example, if one is afraid of flying, what you start with is you show him planes in a picture, then you show him planes on the TV flying. Then the next part you drive around the airport. The next time you get to the plane, and as we're doing this, he gets used to the stimuli, and eventually they can actually do that. Same applies to public speaking. You start by a person speaking to one person, to two, so on and so forth. Breathing exercises are also very, very important, especially for panic disorder or in situations where you feel your heart is beating faster. You take a deep breath through the mouth slowly for 5 seconds. You hold it for 5 seconds and breathe out slowly for 5 seconds. The drugs we use are antidepressants and anxiolytics that come in and help. In the next episode, we shall talk about post-traumatic stress disorder. Thank you for watching and prioritizing your mental health.